I next have the pleasure to introduce to you Cecilia Benoit from the Department of Sociology at the University of Victoria. Cecilia Benoit is an internationally renowned expert on midwifery, maternity care, and the health of vulnerable populations, including Aboriginal women and families, adults in the sex industry, and street-involved youth. Her innovative, mixed research methodologies and highly cited publications has contributed to a better understanding of how law, gender, inequality, and stigmatization affects the health and safety of these populations, both in Canada and in other countries. Welcome.
So I also want to thank everybody for having me here, and it's great to be invited into Rural Society of Canada, and thanks to the Academy of Social Sciences as well. So over the last 3 decades or so, I've conducted multidisciplinary research with other researchers, but also with community organizations, both in Canada and internationally. And I'll talk today just about 2 areas of my research that I think is relevant to becoming a fellow. So first, since I started my career, I've been interested in producing useful knowledge about primary health care for women, children, and families, and how their treatment is shaped by gender, class, and other inequities. Prior to the mid-1990s in Canada, physician care was the only choice of health provider for pregnant women in Canada, and access to reproductive care was thus dependent on where a person lived and in the country, and the kind of physician services that were available for them. And that care was unnecessarily medicalized. So my colleagues and I argue that Canadian women and their families needed greater choice in maternity care, and we called for public attention to midwifery, an age-old occupation that had been highly stigmatized in Canada, in fact was illegal. And yet our investigations of the organization of midwifery in Sweden and other European countries showed that it was a legitimate occupation and provided an important choice for women. So I did research on this topic. I wrote a book called Midwives in Passage, and a subsequent book called Birth by Design, Pregnancy, Maternity Care, and Midwifery in North America and Europe. These works were useful in challenging the laws that were existing in Canada at the time, the dominance of the medical establishment, and led to changes in legislation, first in Ontario, then in BC, and a number of other provinces and territories in Canada. Unfortunately, some provinces and territories still are struggling with this issue. A subsequent book, Receive in Midwifery, brought together my own reflections and those of my colleagues about lingering challenges facing midwives and birthing women after legislative changes in Canada. One important challenge that I identified was the subadequate care of Aboriginal women and their families, and the underrepresentation and appreciation of Aboriginal midwives in Canada. So along with an Aboriginal colleague of mine, I launched a project examining Aboriginal women's maternity care experiences in different parts of Canada, including in the downtown east side, where Aboriginal women are very marginalized and had very little access to culturally safe care. So work that we did there led to publications and so on, but also was influential in the new legislation around midwifery that actually had an Aboriginal focus to it as well, so we could change some of the options available for Aboriginal midwives to make the care more specific to them. I continue to conduct research on the gaps in reproductive care for women, children, and families today. One initiative is called the Her Way Home program, which is kind of a grassroots intervention in Victoria, which is modeled after a number of other interventions in Canada and internationally. And it's an attempt to provide collaborative, kind of one-stop care for pregnant women who are using substances and who are also challenged in regard to poverty, homelessness, and so on. So we've raised about $5 million in the Victoria area and been able to work with the health authorities and the care providers in the community to establish an innovative, what we call harm reduction program for substance-using pregnant women who actually access the service and then also are increasingly able to access housing and other facilities. The research that I have, a couple of CIHR grants evaluating this program, the struggle is that the providers want to provide harm reduction services, but they have a hard time understanding women and their use of substances, and they see an abstinence model as the only approach, even though it's a harm reduction program. So it's a very difficult struggle, and we're trying to think about training for providers that could help them become more understanding of the women that they're treating. The second main area I wanted to focus on is concerning the health and safety of vulnerable populations. So despite the recent focus on vulnerable populations among public health scholars, we still lack evidence-based knowledge about the health disparities that exist among marginalized groups and the characteristics of these populations. This knowledge is essential for developing informed policies and moving upstream so we have opportunities for health promotion and prevention for all Canadians. So my ongoing community-based research in this area of study has added to the knowledge base and hopefully will continue to do so. So one project that I wanted to mention was a study over 15 years ago of a very hidden population very difficult to actually study, which is sex workers. So we did a large study of sex workers, their backgrounds, demographic backgrounds, their working conditions, health status, and life transitions. And that study was dispelling myths and understanding realities of sex workers. Has been used in a number of different countries as well as in Canada to understand how legislation and so on and working conditions impact this vulnerable population. A more recent study that I've just actually started, which is a CIHR team grant, which is a national study of violence and resiliency in the sex industry in Canada, the gendered nature of violence, and so we've done interviews with over 300 sex workers in 6 different provinces, both in French and English, and we are really interested in the contexts of violence and when are sex workers safe. And are there any suggestions there for policy changes? So you may all be aware that the criminal code around prostitution is now being challenged in Canada. So we're hoping that this new data that we've produced will be able to help inform not only the criminal code changes, but also what's happening in municipalities and in provinces around this particular population, which is very much in the news and very much stigmatized. So one of the big findings that we have is the perception of stigma and discrimination is one of the major problems that actually leads to victimization and unsafety for this population. And then finally, a related group of related vulnerable population that I've been studying over a number of years are street-involved youth. So we've been doing a longitudinal study of over 6 years now, following young people who enter the street, men and young females and males, transgendered individuals, and what happens to them when they're on the street, and then how do they exit? How do they get integrated in the society? So the factors that lead to social support, re-engagement in institutions and so on. And overall, those data actually produce a relatively positive view. So we see homeless people, we see street-involved youth, and we think they're always there, but actually there are factors that can help them to get integrated in society. So then, just to summarize, I would say that my research actually has only been possible because of all the wonderful colleagues that I've worked with, but especially the community organizations who are there to try and bring about change in communities at the local level, and then to try to reach out to these vulnerable populations who are very difficult to engage, but who want to have dignified care and to belong in our society. So thanks again for the invitation to be here, and I very much appreciate it.